Hi, so I'm Dr. Joseph Castellano at Castellano Cosmetic Surgery Center. Today we just wanted to talk about breast implants. I think most people probably think that a breast augmentation is one size fits all sort of thing, and maybe some practices believe in that. But here at Castellano Cosmetic Surgery Center, we like to tailor our surgeries just for you. So to show that, we're going to show our different implants that we have here. Starting with a saline implant, which is this one right over here, which is going to be the most fake look that you can possibly achieve, but we really never use this implant. We haven't used this implant in about 2 years now, and the reason for that is because of rippling, which is what you see along the side here. These are also more likely to rupture, feel more fake, and look more fake. If these rupture, they go flat. Everything, all the fluid will come right out of them. Then we talk about our silicone implants, and as you can see here, we have 5 different silicone implants that we use for breast augmentation. This is the ultra high profile Inspiron implant, which is going to most mimic a saline implant. This we typically will not use unless it's somebody that has a very narrow frame and wants a very fake look. Okay. Then we have our high profile implant, which we do use probably about 20% of the time, 20 to 30% of the time. And this is for a woman that does want somewhat of an augmented look, but still natural. Then we have the mid-range, which is what we use the most commonly. We use this about 70% of our breast augmentations. They come in obviously a wide range of sizes. They all pretty much feel the same until we get to this implant here, which is our cohesive, stable form, round silicone implant. This implant is a bit more expensive than these implants, but we would use this implant in someone that started with saline, has really bad rippling, and then we can switch them to this implant, which is the least likely to ripple. And as we can see here, if I press the top, it always bounces right back. So this is going to be the least likely to ripple. But it does feel a little bit harder than your typical Inspiron implants, which is why we use these. These feel very soft and feel much more natural. These 3 implants are approximately the same size, so you can see going from an ultra high profile to a high profile to a mid-range, how the shape and size changes. Then finally we have our stable form silicone implant, which is a teardrop shape. This one we barely ever use, and the reason for that is because this implant picks you. You cannot pick the size of implant that you want. This is really based mostly on the dimensions from your sternoclavicular notch to the nipple and between the nipples. So this implant is going to feel a little bit harder than your Inspiron implants and even your round cohesive implant gummy bear. So for that reason, we typically don't use this implant very often. This is typically in somebody that wants a very small breast, very, very natural look. Then we would go with this implant. So that's a little bit about the different implants we use and how we can tailor this procedure to each patient individually.